waiting outside. One few people just brought in a 20-year-old primey with 32 weeks pregnancy. She was complaining of severe pain in abdomen. Looking at the emergency, the rest of the OPD was kept on hold and the patient was taken immediately in the consulting room for examination. It was found out that the patient was having severe hypertension. Relatives were creating ruckus that why are you spending time on looking at the blood pressure and looking at the pulse, just see what is happening there inside. So the doctor decided, looking at the emergency of the situation, doctor decided that he will conduct sonography because there is severe hypertension, patient complaining of pain in abdomen. It might be an abruption and a timely intervention might save that patient, save that baby for that matter. So doctor decided to take the patient for the sonography, and that was the time when 5 people just rushed in and they were started inquiring to the doctor whether you have filled the form. It was actually a trap and the doctor was caught in the trap.
So संजय दत्त की भाषा में फॉर्म भरना जरूरी है क्या?
I think according to the law, when you are doing the sonography as per the section 4/3, conducting the sonography in the pregnant woman, you should have to fill the record. In this case, you are telling that you should have to fill or not. Again, the Dr. Sharma said in the Permanent Katara case, if there is any emergency, that you should be not following the formality. But you should have to justify it, whether it is an emergency or not. Because every time, frankly, I'm telling you, we are doing so many obstetric sonography, just seeing the fetal heart, etc., and we are not filling the form. This is a crystal clear fact in all, right? So you have to justify that this is an emergency case. But once you have a pain and OPD and you do the sonography, not filling the form, that is not. You should have to put the signature of the patient in declaration, and section has to be filled by your staff, then go for the sonography. This is the idea. But in emergency, there are transverse or whatever you feel that is a hand prolapse or severe APH and whatever, you can do, but you have to justify there.
This
so
justification
is on the treating doctor. Like it was an emergency, so it was done.
I would like to ask to the appropriate authority, this justification is given to the appropriate authority, or I have to give that justification in the court after sealing the machine?
That is
what generally happens, we are talking on rarity.
Yes, sir.
And we are talking on one paradigm that all approved authorities will be there to hang you. It is not the case. We in PCMC, time and again, we have taken repeatedly workshops and one-day conferences to facilitate implemented PCMT Act and MTP Act.
Yes, I would like to give a big round of applause to all these appropriate for this.
Pune people are very lucky, but that is not the situation
it is
at
not
many
about,
places.
it is not about PCMC or me or anybody. It is expected out of that. What is, there is something called as law. There is something called administration of a law and the routine day-to-day administration. In that, the catch is we are all here to prevent a skewed sex ratio. That's the issue. And again, in Maharashtra, we are having skewed ratio. And that is the catch. And what happens is, generally, people are afraid because of ignorance of various provisions, the procedures. And here in PCMT Act, even approved authorities are at the risk of action. So what we try to do is, we always try to facilitate them. And in any issues, we always are open. And most of the time, there is some different experience in Pune, but we take most of our issues to our committees. So it immediately becomes transparent. The issue is, actions taken are not transparent, so there is always an fear. Because fear is about among most of the practitioners, because they feel that each and every mistake committed by a practitioner is known to the approved authority, and that is not the case. But then we cannot explain each other. So whether it is a radiologist, whether even if when I go for even being displayed so much open, when we go for inspection to center, then again there is issue. अभी कुछ देखेगा क्या, कुछ पता चलेगा क्या, फिर कुछ करेगा क्या, फिर उसकी कोई मशीन शुरू होगा. There are always issues. But then what is, there is a, because why this happens? Because the practitioner knows that he is complacent. He doesn't take that much of an care, because we are always afraid covering more patients. Okay, giving more, covering more OPDs and attending more patients. That creates an issue. We are more attending on patient and less on record keeping. And that we know as a practice. So what happens generally, there is a misunderstanding. And I understand that there is very poor impression of right now. And the issue is, it's a criminal act, we don't accept that. Thank you.
Thank you, sir. Thank you.
I would like
Very,
to-
very nice words from the appropriate authority. Advocate wants to add
Yeah,
something.
same situation was there. Dr. Joshi, at the age of 72 years, he is from Dapoli, Raigad district. He is the first gynecologist who started practice at Dapoli and has been rendering services to the all state of societies in so many years. He caught in the same circumstances. It was resulted into IUD. Aggrieved patient, the mother, pregnant woman, to whom he did so many things, she was the first to lodge the complaint with district collector against the doctor. The district collector directed civil surgeon. Civil surgeon formed one committee, including the appropriate authorities from revenue department, from health department, conducted raid. Statement was recorded of the doctor, and doctor took defense, as narrated by so many stalwart people, that it was emergency, I could not get time, I was behind the saving the life of that child and pregnant woman. Ultimately, case was filed. I defended it properly, and fortunately, he is acquitted. Take home all those, like we'll take defense of what we can say, the saving life and all those things. But ultimately, it's very difficult to convince the court. Being all those are private complaints, and the defense which we are going to take, maybe after the period of months together. So court may or may not believe it. Then why you are not raising this issue and slept for so many days? So it is always better to fill in Form F, try to be a law-abiding citizen rather than thinking emotionally from patient perspective. Thank you.
Yes, one more minor sub-question to this.
See,
That whose
sir,
signature...
there is one difference of opinion. Something which is documented in your case paper will be believed by the court. So if you have not documented that patient is in emergency and what was the situation under which you have done, then it will not be believed by the court.
Sir,
but if you have properly
documentation is necessary.
documented, then court will definitely believe.
Sir, try to understand. More than 200 cases I have been defending throughout the state of Maharashtra as well as outside. In the PCPNDT Act, no exceptions, medical emergency and all these things are given. You are talking about Parmanand Katara case. Sir, this is civil case, having no interpretation, no relation as far as criminal proceedings are concerned. We do defend day in and night, various doctors in the court. It's very difficult to convince there and to take defense. Now, I'm representing a few doctors from Aditya Birla Hospital, wherein they have been convicted by the trial court. And defense which was taken by them, doctor could not get time to put signature on Form F, being they were busy in saving lives. What resulted? Ultimately ended into conviction. Now we are defending them in the appellate court, session court. We are hopeful that on technical ground, that complainant was not appropriate authority will be in position to get appeal decided in our favor. But it is very easy to advise. We'll take defenses of medical emergency and all those things. But believe me, it's very difficult to convince, to take such stand and to prove in the criminal court, in the criminal prosecution.
Yes, so
So
the
it is
verdict
always,
goes-
Sir,
it is
let me
always
clarify.
advisable
Let me
and
clarify.
better in PCPNDT Act, no exceptions of any nature are provided.
Yes. Let me clarify. Parmanand Katara is a case of accident, although it is a civil case, but the same judgment is considered and put in multiple criminal cases, including Jacob Matthews, including Suresh Gupta. In all criminal cases, this reference is put, and it is acceptable in all the criminal conditions.
Okay, we
Sir,
agree
okay,
to
so
the panel.
I'll just end this discussion because we have one appellate authority, another one is delayed somewhere. We had through IMA and POGS a meeting with Dr. Kalpana Baliwant, who's our approved authority. I think Walke sir was there, and she very clearly put, in case of emergency, you do an ultrasound, don't worry. Once the patient becomes okay, then take her signature. And just inform this to the approved authority that you have done this in emergency. Once the patient becomes okay, then you take the signature. सर वी आर हैप्पी टू हैव सच पीपल विथ अस. मैं बार बार बोल रहा हूँ लेकिन ये बोलने की जरूरत है.
What I will like to submit is, you have a good rapport with your authorities. Just send a SMS, just two SMS. I have an emergency. I need an urgent sonography for the sake of, and then you can send a detailed email within next 24 hours. What is happening is that if there is opacity and there is no openness, then there is always chance for action, and that openness is not there.
That our appropriate authority has told us that in case of emergency, if your radiologist is not available, you go to any radiologist who may not be registered in your center, get it done. We will follow some procedure to see to it that even this is made legal. So we are lucky.
I think that this is a differ from authority to authority. Our district magistrate in Ahmedabad say, if there is you do the sonography, not fill the form, but before leaving your premises, you should fill this form.
ओके सो अल्टीमेटली फॉर्म भरना जरूरी है. थोड़ी देर बाद भरा तो भी चलता है लेकिन भरना जरूरी है. देयर इज सब क्वेश्चन टू दिस. हुज सिग्नेचर टू बी टेकन ऑफ ऑन द फॉर्म, बिकॉज देर इज नो प्रोविजन ऑन द फॉर्म. लाइक एमटीपी फॉर्म में इफ इट इज अ माइनर एंड सी फॉर्म तो उसके गार्डियन का ले लो, लेकिन एफ फॉर्म में ऐसी कोई प्रोविजन नहीं है. सो इफ द पेशेंट इज अनकॉन्शियस, कोमाटोस, माइनर लेस देन 18, पेशेंट ऑन वेंटिलेटर, any other condition incapacitating the patient from doing the signature, then whose signature should be taken?
I think that if the patient is unconscious, right, we can, there is a provision is there. The patient is having a thumb impression.
No.
Can this be
Unconscious
taken?
thumb impression is no,
Can
no,
this
no,
be
no.
taken?
See, again the law is very much clear. In each and every law, you should not write that in absence of competent party, you should not take signature, or you should take signature of guardian. It is well defined principle that if a person is not competent to sign, the person not competent means it is defined in consent also in Samira Kohli case.
Yes.
Not competent means below 18 years,
Not mentally
not
sound.
competent to sign. If under the effect of anesthetic or intoxicating substance, then if insane or lunate or Mongol who cannot understand. So if person is not competent, then signature of guardian is to be taken. Right. Now what is the definition of guardian? That is defined in a different way in different act. So we cannot discuss it.
Okay.
So but for at least Pune sake we are done, no? Emergencies is done now for Pune sake.
No. The normal minor 15 years female walking in with a relative for an obstetric sonography, will you take signature of that 15-year-old or the guardian? Because I have seen many radiologists taking signature of that 15-year-old. That's why this question is here.
The signature of guardian is essential, but then you have to be aware that that person is a guardian. There may be impersonation, and that happens time and again. That happening in various cases. Other relatives or non-related people are taking the young girls for this kind of an investigation. That is harmful. If anything goes in the court of law, if there is a police case, we will sue.
Again, authority want to squeeze you, then say
Again,
that you file the case.
Again, there is a little bit difference of opinion. मुझे पैनल में डिफरेंस होता है ना, तो आई एंजॉय ऑलवेज. द डिफरेंस ऑफ ओपिनियन इज इन मल्टीपल जजमेंट्स इट इज टोल्ड दैट डॉक्टर्स आर नॉट द इन्वेस्टिगेटिंग एजेंसी. ओके, वी आर नॉट सपोज टू इन्वेस्टिगेट कि ये इसका बाप है कि नहीं, ये माँ है कि नहीं. व्हेन समबडी इज कमिंग एंड टेलिंग दैट आई एम फादर और आई एम मदर, इट इज टू बी बिलीव्ड by the doctor, and doctor is not an investigating agency. घर जाके चेक करेगा वो इसका फादर है कि. So in most of the MTP cases where boyfriends are coming as a husband and later on girls are filing case कि भाई ये मेरा करा दिया है अबॉर्ट, अब शादी नहीं करता है, वादा नहीं निभाया इसने, and doctors are also included as a party. So in those cases no case is decided against doctor. Okay, don't worry for that. You are not an investigating agency, but for your safety you should take signature of the person who is accompanying, and you should take in writing that this is my relation with this patient. That's all.
Yes.
The issue arises if anything goes wrong, our doctor is not able to who was that person. त्याचा नंबर काय होता. Then I fully accept what you are doing legally, but what happens if there is a court case, if the police case, and that girl dies, and later on if there is a police case, if doctor is asked Okay, then he is asked who was that accompanied person. And being a doctor, how you are so careless not to know a person. You at least take a phone number or any ID if you have. It is, if it is possible. It is not for the purpose of implementation law. It is just to, in the interest of
Safeguard
our
us.
doctor. We should.
Not to go in the court.
हाँ, we
What
should.
you are trying to say is go in the court so that आपका धंधा चले. वो नहीं चाहिए.
हमें प्रैक्टिस, हमें लॉयर नहीं बनना है, हमें ऑब्स्टेटिक्स से
You
प्रैक्टिस
should
करना है.
keep the ID of the
ID,
board.
ID, second.
We will be happy to have opinions and carry on message so that our cases don't go in the court. And what if I am abundantly cautious and taking signature of the girl also who may be 15-year-old and of the person also who has come and try to find out the relationship of the girl with the person, what is the harm? If I am abundantly cautious, it's okay. नहीं, अगर मैं cautious नहीं हूँ तो जाएगी कोर्ट केस में, ज़्यादा से ज़्यादा क्या होगा?
जितेंद्र
ये
की
रीच
दुकान
हो
चली
जाएंगे,
गई.
हमारा क्या होगा?
We have next case now. This happens many often. 24 years female, G3, P2, L2 with previous 2 LSCs, 20 weeks pregnancy, pain in abdomen, clinically irritable uterus, admitted as a threatened labor, admitted, ultrasound done, remains in 2 days in your hospital. You try to stop the delivery and unfortunately she aborts on 3rd day. And now the appropriate authority comes and that you had terminated her under the disguise of inevitable abortion. Now what to do?
The issue is, can your papers save you?
Yes.
That is the
So
whole thing
everywhere
is.
documentation is important. The similar case was there filed in Gujarat High Court, and the case is just now in Ahmedabad Obstetric Gynec Society. Secretary of Society, Dr. Mukesh Savalia. He was prosecuted in a case in which at 20 weeks, patient came with full dilatation with bulging membrane. Okay, and now he had to deliver that patient. Now he delivered that patient at night 1:30 a.m. Later on, there was a fight between husband and wife, and they got separated. And she filed a case against that person, husband, for 498A, and in which she had mentioned that in conspiracy with doctor, this
मुलीच्या
my
सासरच्या
husband has
माणसांनी
aborted
डॉक्टरांशी
my
संगनमत करून तिचा
pregnancy.
अवैध गर्भपात घडवून आणला.
Now what was the case? Okay, there was no documentation available. And you know, without documentation, he was made as an accused.
Yes, definitely.
And he was to be, he was kept in jail. He had to ask for bail. So
Documentation is
always
important.
documentation plays the role. If you properly document this, patient has come with this complaint, this treatment is done, this is the progress. So if that will definitely save you. But in court of law.
Coming
Again, I
to,
mean, there are
Extra documentation should be
many
always
times-
safer.
Many a time, as being a medico-legal expert, some people give us a call. अरे दिलीप एक 14 weeks pregnancy आहे आणि फेलियर ऑफ कॉन्ट्रासेप्शन तिला माहीत नव्हतं आणि ती प्रेग्नेंट झाली आणि आमच्या हॉस्पिटलचा असा नियम आहे अंडर द हॉस्पिटल वेअर शी इज वर्किंग असा नियम है कि वी डू MTP ऑफ फॉर सेकेंड ट्राइमेस्टर ओनली फॉर कंजेनाइटल मालफॉर्मेशन. तो मैं ऐसा लिखूं क्या, कुछ उसको टैबलेट दूं और वो इनएविटेबल अबॉर्शन करके आई है और वो अबॉर्ट हो गई, तो लेट मी टेल यू प्लीज डोंट गेट इनटू ऑल दिस. इफ इट इज प्रूव्ड then it will be a case of forgery for which you have to be arrested, and if there is a negligence so at least सिर्फ compensation है.
Yeah.
अगर forgery हुआ
Sir-
तो arrest है.
sir,
तो उसमें ये भी नहीं बचा पाएंगे अपने को.
Yes.
okay,
Yes.
we'll move to the next case with the 3 more cases pending, and we have a very short of time. This is a case where the PCPNDT inspection is going on in a center, and one paper where the problem was found out by the appropriate authority. It was sonography of a patient who was 7 weeks pregnant, and there was some mistake, some address of the patient was not written or the signature was not done. So, so law says every deficiency in record keeping goes as a contravention of section 5 and 6. Can this be, can this case also goes there or not?
Sir, actually, the state appropriate authority, they have issued us a letter stating that we should always give a notice in under section 21. So that most of the appropriate authorities, they are actually practicing, I feel so. So there we have the chance, and then we can always defend
No,
ourselves.
my question here is, the law says any deficiency in paperwork.
So the same
amounts
law
to
says-
sex determination.
The
right?
same law says that they should be given the opportunity to say this, for their sayings. So under section 21, we can always
So
give
we
them the
want a
notice and we can
clarity
go ahead
that
with
if
that.
you issue a notice under section 21 that such and such deficiency was found, and if I give a clarification या गोष्टीमुळे हे राहिलं होतं की काही तर ते तिथंच थांबतं का मग आमच्या अगेन्स्ट केस होती? येस येस येस
एक इश्यू ऐसा है कि वी हैव टू सेपरेट बिटवीन डिफरेंशिएट बिटवीन ऑफेंडर्स, वन टाइम ऑफ फर्स्ट ऑफेंडर एंड रिपीटेड ऑफेंडर्स. हमारे पास एक बड़ा इंडेक्स केस है, आपके पास पुणे का बहुत बड़ा केस है जिसमें 8-10 लोगों को एक ही बार में कन्विक्शन हुआ है. बिरला केस, आई विल जस्ट इलिसिट थोड़े में. बिरला केस में ऐसे हुआ था, बिरला केस हुआ टोटली मैनेज. मैं बहुत ही अपलोड बनने के बाद में 3-4 महीने में हुआ था. तो केस होने के बाद में व्हाट हैपन कि दे ट्राई ऑल द पीपल ट्राई टू मैनिपुलेट ऑल द डॉक्यूमेंट्स and they try to manage each and every aspect of that case, all the departments. Then what happened ki somehow we got rid of all the notices we have served them, and after each notice all those authorities, those hospital authorities had given in writing that they will comply against all those notices. And when we went through all the documents, they didn't comply at all. And those were things we submitted in a court of law, and they were proved to be habitual offenders. What I want to submit here is, my request will be, don't become habitual offenders. If you get a notice, try to comply, improve upon that, don't give away. What happens ki complacency will prove us a habitual offender, and that is going to be proved in a court.
So if we give our explanation at the appropriate
we
authority level,
give
or the-
explanation, we will put up, we will do fulfill all those whatever deficiencies are there,
Yes.
but we don't comply. That's the issue.
नाही, आम्ही तुमच्याकडनं आम्हाला नोटीस आली आणि आम्ही जर असं उत्तर दिले की ज्या त्रुटी आढळल्यात त्या त्रुटींची पूर्तता करण्यात येत आहे, तर मग केस रिपीटेड ऑफेंडर नंतर झालं तर डज द अप्रोप्रिएट अथॉरिटी अँड द बोर्ड हॅव द पॉवर की इथंच थांबलं, परत केस म्हणजे पुढे कोर्टात केस न्यायची गरज नाही, दॅट पॉवर रेस्ट टू द अप्रोप्रिएट अथॉरिटी.
बेसिकली याच्यामध्ये आमची जी कमिटी आहे, पीसीएमसी कमिटी समोर जाते, आम्ही ते कॉम्प्लाय करून घेतो. पीसीएमसी मध्ये आपण असं करतो आणि ते पुढे जात नाही. सम पीपल विल लाईक टू टेक इट टू द कोर्ट. Okay, that is their choice. But then we can always give one chance, and we see whether the person is first offender, is he improving or against the deficiencies or not, or he is habitual.
Okay,
if
thank
he is
you, sir.
habitual, we can take on.
So message is, if there is a notice under section 21 and you agree that I will comply with the ज्या काही त्रुटी आहेत त्या त्रुटींची पूर्तता करण्यात येते आणि पुढं असं होणार नाही असं तुम्ही लिहिलं तर द अप्रोप्रिएट अथॉरिटी अँड द बोर्ड हॅज द अथॉरिटी to settle it down there, and it's not necessary that it should be made into a case every time.
No, not the पूर्तता करेंगे ऐसा नहीं. हाँ, पूर्तता कर दिया वो भी नहीं. That is not enough. The basic thing that you have to prove that my intention was not wrong, and to prove that if possible जो भी 1-2 केस में difficult form में problem है, you should put affidavit of the patient in writing to save yourself, and you
अगर appropriate
sex
authority मांगता है तो देंगे.
I have not demanded and it is not done, so it will save you.
Thank you, sir. Thank you.
Just a small point in
Multiple
this
cases
case. Everything is done. That is not the issue. My issue is what? This is a 7 weeks pregnancy. You cannot detect sex of the fetus at 7 weeks. Can this be taken as a defense in this case? That is what I want to say.
But that will not be accepted because now law is very much clear that you have to fill form even at 4 weeks and even at 44 weeks. So, and any deficiency in filling form is a criminal offense. So you can take that one of the defense, but that will not be accepted in most of the
Take home message, you should, even the 6-week pregnancy, you should have to fill the form.
Any patient.
Question is not about filling the form. Law says deficiency there amounts to sex determination.
I think there is a lot of gray area, and that's why this.
Yes, ma'am. Yes, minimum.
Suppose it is UPT positive, but on ultrasound you don't see a sac. Do you still fill up the form and send it, or you don't?
No. Once I think that there is no pregnancy, when you put the you should have to fill the form when there is a, on the pregnant uterus. You put the
UPT is
probe.
positive.
Only UPT is positive.
UPT, I think,
which can be
UPT, I
sometimes
think that
falsely
you
positive.
should expert that rely on UPT or sonography.
Sir, you will do sonography only after filling the form.
Right?
You
Well,
will
no,
do
no, I'm
sonography
telling you
only
that
after
she is
filling
not
the
seeing
form.
any gestational shake, right? Gestational shake.
See, when UPT is positive, so under which indication you are doing sonography to confirm the viability
Right.
or
Pregnancy.
gestational age or to confirm the yes, SAC is there or not.
Also whether it is an
So you are
ectopic or-
supposed to fill form if UPT is positive and you are doing sonography.
Yes, yes, you have to fill
You
your
must fill.
And so what, okay, what, which
The
report
UPT,
you are
the
writing
patient is
then?
saying that she's pregnant.
No, then what
You
report
should
you are
write
writing?
that no gestational sac is seen.
non-pregnant.
That's
Report
F form is must.
F form is must. Now one more thing, one
Just
more
to,
gray area.
just to sir,
Because when
this
UPT
is for
is positive,
Yes.
the patient is pregnant.
Yes, yes.
And what is written that whenever you
I
do
think that,
sonography
in
a pregnant
sonography-
woman, then you should fill
Yeah.
the form.
I think
F
So
form.
okay, so form
UPT
F has to be
post-negative,
filled.
post
That is very
positive.
clear. Sir, Pawan sir, this is one question for you, just to sum up the previous one, and also for Varsha. 21 is okay. You give a show cause notice and appear within 7 days and all. How many times it happens that you seal the machine under 23? Because that says under public interest without giving a notice, you can seal the machine directly.
I think,
Lot many things, as is a criminal act, we can do lot many things. But that is not, because administration should be in a mode to facility implement law.
Thank you, sir. बस इतना ही सुनना.
कायद्याच्या अंमलबजावणीच्या पाहिजे, कारण होत आहे कशा बऱ्याचदा नाही हे सगळ्यांना अनुभव येत नाही. दोन गोष्टी आहेत, आपल्या प्रॅक्टिसच्या बाजूनी पण भीती असते आणि ऍडमिनिस्ट्रेटरला पण भीती आहे पीसीबी ऍक्ट मध्ये
SOP
की
मुळे
मला
आहे.
काही कारवाई होईल का.
हो, SOP
तर
आहे.
BC दोन्ही बाजूने कॉन्फिडन्स नसल्यामुळं हे प्रसंग वारंवार येतात. प्रत्येक वेळेस आपली कातडी वाचवायसाठी दुसऱ्या अंगा ढकवायचा प्रयत्न करतो आणि मग त्याच्यामध्ये ओपेसिटी असल्यामुळं त्याच्यामध्ये मग कोर्टाकडे जातं आणि मग एकदा कोर्टात गेलं की आपल्या हातात.
Sir, I give the one guidance to you. Whenever there is a national inspecting monitoring committee goes, then if I suppose go to the SIR area, right, and they are the mindset, just ask the SIR to seal the machine, right? This is a section 20/3 and suspend the register. This is not, never believe, you ask the national inspecting committee, you should write your report, whatever decision I would like to take, because in the simple
Nancy
error,
does not have
you
the
should
authority
not
to seal the
take, you
machine.
should not take.
Okay.
But again, I'm telling you, if I find the suppose one clinic, the plenty of suppose M-Credil and in our Visnagar there is a 6 or 7 patient of the
Second
fetal abortion should be there are lying. Then the SDM is stealing this whole, even the hospital, right? So in this case, the 20/3 is applied.
Carry home is good. 21, our appellate authority believes in 21.
Yes.
We are happy.
Not 23.
21 is always
Act is
better.
absolutely clear. When he is in position, appropriate authority is in position to give in writing that why I have sealed immediately, then he can seal. That's all. Suppose sting operation is done and somebody is caught red-handed, then he can definitely seal under
Correct.
23 also.
Okay, we move on to next
21
case. We
notice
move
is
on to
not
next
required.
case. We are running short of time. A patient comes to you, early pregnancy, 8 weeks pregnancy diagnosed. You write in F form in the column number 19 that there is no indication as per the MTP Act for MTP. And after 1 week they come again. Now we want to do MTP and we do a MTP. So अभी क्या करेंगे? एक बार लिख के दे MTP नहीं, कोई indication नहीं है, अभी फिर MTP कैसे कर रहे? So how do you face this?
I think that please read the column number 11, 12, 13, 14, 15 of the section B. Date on which sonography done, result is conveyed to the patient, etc., right? So you can defend this case is like that. On that day, date is there, right? Your date on which you should have to keep this, preserve this form, right? So this is a very simple, if this particular date you had done the sonography, at that day, there is no any result conveyed to the patient. It is normal 6 weeks pregnancy, not required any MTP or etc. So result already been conveyed, and after the week, if patient comes, then I think this is a defense you should have.
Sir, absolutely clear. Form F, column 16.
Yeah.
It says indication of MTP. That means you have found any indication by doing sonography
Yes.
for MTP.
No.
No.
So in most of the cases, it will come no.
No. Right.
Okay, because if there is anomaly, only then there will be indication. Now suppose today you have done sonography, according to you there is no indication. Now patient has come for the confirmation of pregnancy. Okay, you have confirmed the pregnancy of 8 weeks. Now after 1 week, that husband and wife comes that this was due to contraception failure and I want to undergo MTP. So that is an indication, but not according to sonography.
So the take-home message is that in Form F,
That
they are
can be
asking
done.
only indication whether there is indication on ultrasound, and there are 4 other indications in the MTP Act which can be very well utilized for that. Yes. Last case we go. Dr. PJ recently has upgraded the sonography machine and brought a new brand machine. Done all formalities of registration. Company is not ready to take the old machine in buyback, so effectively he has to retain his old machine. Uska kya kare? Old machine ka kya kare?
I think there is a also gray area that when the central government is not amended anything like that, there should be the electronic biomedical disposal of the, right? But still, I'm thinking that we should have to ask the central government, please do this. Otherwise, you should keep the machine and do the volunteering. This is only the solution, because the authority will...
I want something from appropriate authority. Sir, क्या करे? बासनात बांधून ठेवायचा, हातोडा मारायचा, जाळून टाकायचं, काय
नाही,
करायचं?
बेसिकली एकदा मशीन आपल्याकडे आली आणि आपल्याकडं नोंद झाली आणि आपल्याला MRC नंबर पडला तर आपली जबाबदारी झाली.
म्हणजे
जबाबदारी आपली झाली की तिची विल्हेवाट लावायची नाही. जोपर्यंत आता आमच्याकडे काही असे संस्था त्यांच्याकडे 5, 10, 15, 20, 25, 30 पर्यंत मशीन आहेत आणि ज्यांनी अप्लिकेशन केलंय ए फॉर्ममध्ये त्यांनाच माहिती त्यांचे कुठल्या मशीन कुठे ठेवल्यात. असे पण संस्था आहेत आपल्याकडे, कॉलेजेस आहेत, मोठ्या मोठ्या हॉस्पिटल्स आहेत. तर त्या परिस्थितीमध्ये आम्ही त्यांच्याकडून एक ॲफिडेविटमध्ये सगळी यादी करून घेतली की तुमच्या मशीन तुम्हालाच माहिती कुठे आहेत. एक गोष्ट बरेचदा काय की मशीन्स कशा कुठे ठेवल्यात हेच माहिती नाही आहेत. आणि बेसिकली ह्याच्यामध्ये तुम्हाला मशीन जेव्हा विल्हेवाट लावायची तेव्हा आम्ही PCMCमध्ये एक प्रयत्न केला होता की तुम्ही आम्ही एक दोनदा एक सेशन घेतलं. जे विकत घेणारे जुने मशीन त्यांनाही बोलवलं, पण नोबडी टूक पेन्स टू कम देअर अँड गिव्ह देअर इन्फॉर्मेशन. त्याच्यानंतर आता आम्ही परत लोकांना बायबॅकमध्ये परत यायला परवानगी द्यायला चालू केलं आहे, पण पीपल डोंट कम फॉरवर्ड. बऱ्याचदा होतं की लोक त्यांची प्रॅक्टिस बंद करतात, सेल्स मशीन ठेवून देतात. आणि जर उद्या ह्याच्यामध्ये एकच धोका आहे, जर कुणी याच्यामध्ये अप्रूव्ड ऑथॉरिटीला असेल किंवा महापालिकेला किंवा कुठल्याही संस्थेला RTIमध्ये विचारलं तर एव्हरीबडी विल यू सूप इन्क्लुडिंग द अप्रूव्ड ऑथॉरिटी की यापूर्वी किती मशीनला परवानगी दिली, MRC नंबर काय आहेत, त्यांची सगळी आम्हाला माहिती द्या, मग त्यांचं काय केलं. तर तो म्हणजे बॉम्बस्फोटचा विषय आहे. तर माझी सगळ्यांनी विनंती आहे, तुम्ही सगळ्यांनी तुमच्याकडच्या मशीन ज्या अधिकृत कंपन्या आहेत त्यांना 5-25 हजार रुपये देऊन मशीनची विल्हेवाट लावणं जास्त योग्य आहे. आपल्याकडं आपली मानसिकता महाराष्ट्रीयन अशी की ती मशीनचे मला 10,000 रुपये कमी करतो, माझी मशीन पुढे नव्हती, मी देत नाही तुला. बेसिकली मशीन आपण होल्ड करतो, म्हणजे मशीनची विल्हेवाट लावणं, तसं रेकॉर्डवर येणं आणि आपण मुक्त होणं जास्त गरजेचं आहे. पण ते न होता मशीन कुठेतरी ठेवली जाते, त्याच्यावरचं सील निघून जातं आणि जर कधी तक्रार झाली अगेन विल प्रॉब्लेम. नॉट ओनली डॉक्टर्स, इवन अप्रूव्ड विल इन प्रॉब्लेम, कारण अशा अनेक मशीन आहेत. सो वी हॅव टेकिंग द टेक देअर एफिडेव्हिट्स.
आता जुनी मशीन घेत नाही कंपनी, लोक घेत नाही, कारण त्यांच्याही गळ्यात धोंड आहे बऱ्याच. त्याचं पुढे काय करायचं?
Sir, I will give you example. See, in most of the corporate hospitals where we are dealing, this problem comes very frequently because MRI machines and all that kind of machines, they are registered under PCPNDT and they have limited lifespan. So after suppose 10 years, they are supposed to destroy. So in PCPNDT, though there is no provision, but there are different biomedical waste related acts. For radiation, there is a different disposable team. For plastic disposable, there is a different team. So you have to do the disposal of that machine according to different biomedical waste acts. Plastic disposal to be given to plastic vendor, radiation disposal to be, that radiation tube should be handed over to the radiation disposal
Do we
system,
require
and you have
permission to do that?
You have to get the certificate from those agencies, and permission is not required. You have to acknowledge the appropriate authority that we are giving to the government recognized vendors, biomedical waste disposal vendors, and they don't refuse.
Is there any government recognized vendor?
Yes. In all the cities there are. Yes. that is electronics part disposal waste system. Vendors are everywhere.
Okay. Because one of my colleagues in Solapur district, they asked the civil authorities वहाँ पे कि क्या करना है, तो आपके पास ही रखो और कुछ नहीं करना बोले.
No, you can go for voluntary sealing also one thing, but you can always give it to the vendors who are specified by आपल्या state appropriate authority. They have given us a
vendors
letter.
are
Yes,
for
there are
destruction of
vendors.
machine.
Yes.
See,
You
even
can
with
sell that machine
voluntary
to them.
sealing, MRI machines you are not supposed to keep in your premises after completion of 10 years because they are hazardous.
Hazardous.
So you are
So
supposed
you
to
have
Sir,
to
we are
dispose the
talking about
machines
sonography machine
with
in the case, that's why I said.
vendors who are ready to get.
There is one question from the audience. I'm just giving that question to you. I have a gynecologist in my clinic and I'm sending blood for NIPT. For sending blood for NIPT, do I need to be registered? Yes. Mine is a clinic. Yes. I'm just drawing the blood and sending it for NIPT.
Refer Rule 14 subsection 1. It is clearly mentioned in PCPNDT Rule 14(1) that if your center is not registered as genetic clinic, no genetic laboratory will receive your sample.
Patient to that center to collect the blood even.
Yes, sir.
Best is to
Yes,
send
sir.
them to a lab
And
which collects
what
it and
about
which
double
is
marker,
registered.
triple marker?
They are not
We cannot
PCPNDT
determine sex
procedures.
from double.
Genetic lab can only took the sample from the genetic clinic. Yes. Right? So better to send the patient
Suppose you are registered as ultrasonography clinic only, then they cannot collect sample from your place. बीच में वो घर से भी collect करते थे NIPT का बॉम्बे में, and that created the problem, and that's why that Dr. Asha Advani this restricted the.
For that debate, and thank
Thank
you the
you so
panelists.
much.
Thank you.
Thank you, Dr. Sudesh Toshi and Dr. Santosh Jaibai, and all our experts for an excellent discussion. Thank you so much.